Kent Surrey and Sussex Learning Disability Community of Practice for inviting us to speak and for the opportunity to share our project with you. So the name of our project, as you can see, is the Audiology, Learning Disability and Autism Project, or ALDAT for short. And we're based in the University of Manchester in the Manchester Centre for Audiology and Deafness. And the sponsors of the research are Health Education England in the South East. So the project will be run in Kent, Surrey and Sussex. So I'm just going to introduce us quickly. So first of all, Siobhan, who is the principal investigator. So Siobhan, do you just want to introduce yourself quickly?
Hi there, everyone. So my name is Siobhan Brennan, and I work at the University of Manchester, and also at I'm also an audiologist at Sheffield Teaching Hospitals as well. Lovely to meet you.
And Shanice Thomas, who's a research assistant on the autism strand of the project.
Yep. Hello, everyone. Yeah, nice to meet you. My name is Shanice, and yeah, as Marianne said, I'm running the autism strand, but also working with on the learning disabilities strand.
And I'm Marianne Day, and I'm a research assistant working on the learning disability strand of the project. So we've got different parts of the project running at the same time. We're all concentrating on different areas. The outline of our talk. So first, I'm going to talk about what's the problem. So in that, I'll be talking about how common hearing loss is in people with learning disabilities and autistic people, and the impact it has. And then Siobhan's going to talk a little bit about the nature of hearing loss and how it's identified by audiology services, and also a little bit about how it's picked up less effectively in people with learning disabilities and autistic people. Then I'm going to talk about what we think are some of the barriers to identifying and managing hearing loss, and how we could reduce these barriers, or how we think we could reduce them. And then we'll talk about our project. So what the aims of our study are and what the project entails. So we want to talk to people with learning disabilities and autistic people, because while we have some understanding of what the issues are, it's very valuable to talk to the people who are actually using the service. So as part of that, we're trying to make our research as inclusive as possible. So we'll talk a little bit about the adjustments we've made to our research project to allow people to participate. And then we'll end with what our next steps are in the project and the help that we're looking for. And while we're talking, Shanice is going to put a link to a form into the chat. So this form, if you were interested in participating in the study, or if you were an organisation that thought that you could be involved in the study or help, or if you have any suggestions for how we can approach and recruit people, then if you want to put that into the form as we're going along, that would be really helpful for us. Okay, so I'm going to start off with the prevalence of hearing loss. So approximately 2% of the UK population have a learning disability. So that's approximately 1.4 million people, and 700,000 people in the UK have a diagnosis of autism, which is about 1.1% of the population. But as I've put, that won't be everybody with autism, because there will be people who don't have a diagnosis. Hearing loss is sort of 4 to 8 times more likely in people with learning disabilities, which means that about 40 to 45% of people with learning disabilities will have a hearing loss of some form. And there's higher risk in some people, in some groups with learning disabilities. So for example, in Down syndrome, the prevalence is probably over 50%. People with learning disabilities also have higher levels of ear infections and earwax. So earwax is a problem for about 2% of the general population, but about 33% of people with learning disabilities. And that's a big problem for audiology, because when people go to have a hearing assessment, if they're affected by earwax, then that means you can't get an accurate measure of hearing. So earwax needs to be cleared before you can have an accurate hearing assessment. And hearing loss is around 10 times higher in children with learning disabilities, autism, or both. So, so it's a big issue. There's sort of approximately half of people with learning disabilities have a hearing loss. So it really is an important issue. Hearing loss is also sometimes not recognised because it can be overshadowed by other aspects of what's going on with people. So if people might mistake a hearing loss for cognitive difficulties, or with autism, there's sensory aspects of autism which can affect recognition of hearing loss. So delayed speech development, attention deficit. So you might think somebody's not listening to you. You might think it's because they are distracted, but they might actually have a hearing loss. So it can be complicated to identify hearing loss. So what is the impact of hearing loss? So in the short term, how can we tell if someone has a problem with their hearing? So if somebody developed a hearing loss, so something like not responding to their name, or turning up the TV louder, or speaking louder, or sometimes being startled by people approaching because they didn't hear them, and pulling ears and hitting their heads, this might indicate an ear infection or a problem with earwax. So hearing loss has major impacts for people. So in children, hearing loss impacts language development, communication skills, and social skills. So there's lots of evidence that the earlier that you intervene with children with a hearing loss, the better their outcomes will be. There's also some research which suggests an association between behaviour that challenges in people with a learning disability and hearing loss. So that might relate to people not being able to understand what's going on around them. And also for autistic people, the world can be confusing sometimes anyway. So if you take away the cues around hearing, then that makes the world seem more confusing. And then inclusion. So having a hearing loss will affect people's opportunities. So whether that's leisure, work, or education, their ability to make choices and live independently, and their ability to self-manage their own health. There's mental health impacts of hearing loss, so it can affect people's confidence, self-esteem, quality of life, and it's been linked to depression and isolation. And there's studies that show that deaf people have poorer health than the general population. So with people with learning disabilities, who are already a group that tend to have lower health also than the general population, that is likely to make people with learning disabilities and a hearing loss a particularly vulnerable group. So now I'm going to ask, flip forward a slide. I'm going to ask Siobhan to just talk a little bit about what we mean by hearing loss and what audiology does.
So this particular slide shows a cross section of the ear, and what audiologists tend to do is think of the ear in 3 different parts. So we think, and they will describe it like this. So if you think about, or if you hear an audiologist talking about the outer ear, what they're referring to is the part that we can see, but also the ear canal, and to a certain extent the eardrum. The eardrum acts as a boundary between the outer ear and the middle ear. When they're talking about the middle ear, what they're talking about is like a little pocket of air, which has 3 tiny little bones. And those bones are used to make the sound louder before it reaches the inner ear. When we talk about the inner ear, what we're referring to is the cochlea, largely, and to a certain extent the auditory nerve. So what the cochlea does, it's a very, very exciting part of the body. What a cochlea will do is it will convert acoustic sound or vibration into an electrical signal. in the same way that a microphone does. If you think about what a microphone does, it takes your voice and converts it into an electrical signal that will travel down the wire. So that's what the cochlea is doing. And then the electrical signal, as it travels up the auditory nerve into the brain in a form that the brain can identify. So there are lots of different types of hearing loss, and one of the things that audiologists try to do is identify which part of the ear might be causing a hearing difficulty. Now, there are lots of different types of hearing loss, so I'm just going to just touch on the most common ones. So starting from the outer ear, earwax. Now, earwax is actually a good thing. Earwax stops too much dirt going too far down the ear. It catches dirt as it comes into the ear and stops it affecting the eardrum. So wax in itself is a good thing, and the ear is usually very good at pushing earwax out and will come out by itself. However, for about 2% of the total population, you can have too much of a good thing. The earwax can get stuck, and it can start to get really hard and really uncomfortable and cause a blockage. Now that has major implications. That can cause a hearing loss in itself, but it can also mean that there's more likelihood of an infection as well. So if earwax is a problem, we do need a little bit of help getting that out. And you can get earwax out either through sending water down. You'll get that in GP surgeries where they send some water down and that encourages it out. Or you can get in ear, nose and throat departments in hospital, you'll get a really, really tiny hoover. You'll hear it called microsuction, where it's just sucked out. So earwax, as I say, is an issue and something that we really need to keep an eye on. Then in the middle ear, this is the hearing loss associated with the middle ear is something that's extremely common in young children. So between the age of about 2 and maybe 7 or 8, if you were to go into a classroom, about 1/5 of children may have some congestion in their middle ear. And in some cases, this causes a hearing problem. So that middle ear where the bones are, it's supposed to be a little pocket of air, but it can fill up with, you know, the sort of fluid that you get during a cold that can sit in your middle ear. And that means that the bones can't move and the eardrum can't move like it should do. So that can cause a hearing problem. And as I say, very, very common in children in particular. Then the most common sort of permanent hearing loss is affecting the cochlea. Now, about 1 in 1,000 babies are born, between 1 and 2 in 1,000 babies are born with a hearing loss that affects the cochlea. And this type of hearing loss that affects the cochlea is very, very common as we get older. So if you look at the population, about 17% of us all have a hearing loss of some form. And this is a very, very common one. So if you hear people talking about presbycusis, what they mean is a hearing loss that affects the cochlea that happens as we get older. That's right. So if we move on, maybe a couple, I'm not going to risk trying the sample, but that link is definitely one that people might want to try afterwards to hear different types of hearing loss. I think that might be quite interesting for people, but I daren't risk dropping out again. So I think if we move on to the next slide. So in terms of whenever we're trying to identify a hearing loss, there's basically 2 things that we're trying to do. One is we're very interested in ear health. So we want to have a really good look. Are there any infections there? Is there earwax? Is there anything that we should refer somebody on for a medical investigation? So should we be referring on to the ear, nose and throat team? So this is one of the reasons that you'll usually find at the start of an appointment, one of the things that audiologists want to do first of all is have a really good look. And we will ask about all kinds of things. We will ask about people's medical history. We will ask about any pain in the ears, any balance problems and things like that. Then we also want to know what is the quietest sound that people can hear. So the sounds that you'll sometimes come across in an audiology clinic is little beeps. Now you might think, well, why do we care about those little beeps? Little beeps is not something that we listen to terribly often, but it gives us a lovely idea about how people can hear across different pitches of sound. So if you imagine the notes on a piano, we're very interested to know if somebody can hear low pitches at the same level as they can hear high pitches, because that can be different for people. Now, in terms of identifying the quietest sound that people can hear, we can do this in different ways. We can either use behavioral methods, but to do that, somebody needs to have two skills. They need to be able to wait for a sound, but also they need to be able to respond when the sound comes along. And if that is complex, if that's something that's not working for somebody, we could also do a test where we can put little sticky pads on somebody's skin, and then they can lie back, and we can record the responses in the auditory nerve without the person needing to do anything at all. So that person can just wear headphones and either sit up or lie down, and we can assess somebody's hearing that way. You'll often hear that referred to as electrophysiology. Tympanometry, there's a picture there of tympanometry being used with a child there, and that's because it's most commonly used to identify if there's any glue ear. So I was talking earlier about the fact that that's very, very common in small children. And so we just see how well the eardrum is moving, or whether there's so much fluid in there that the eardrum can't move terribly well. So these are the big terms that you'll hear audiologists use. Otoscopy, to look in somebody's ear. Audiometry usually refers to any kind of behavioral method, asking someone what they can hear. Tympanometry is where we look at how well the middle ear is working. And then electrophysiology, where the person doesn't need to do anything at all, and we can just record the electrical activity inside the ear. Okay, so if we move on. So in terms of amplification, I think what I would say is, if there's one message that I would want everyone to take away, is that hearing aids are like any other technology. They have improved exponentially in terms of what we can offer, in terms of background noise reduction, in terms of directional microphones, in terms of the comfort in somebody's ear. Now, what's available in different parts of the country is different, but on the NHS, it is possible to get in-the-ear hearing aids. Now, the little in-the-ear hearing aids that you'll very often see advertised on the TV are really only suitable for mild and moderate hearing losses. They're not terribly helpful for severe and profound hearing losses, so they're not suitable for everyone, but they are available. Cochlear implants are a very, very exciting form of technology, and they're very, very good for severe and profound hearing losses. There are bone conduction hearing devices, so they just sit behind the ear. And we're very, very interested in knowing about people's relationship with sound. So if somebody rejects a hearing aid, it may not be how it sounds, it might be how it feels. And so a lot of departments have a hearing therapy team who can talk to people about their relationship with sound. And while hearing aids were originally designed to improve speech understanding, they're getting much, much better at helping people listen to music, because this is something that people very often miss and are very, very upset by losing if they develop a hearing loss. And on that sample of a hearing loss that was on that previous slide, they have some examples of what a hearing loss may do to somebody's enjoyment of hearing. That's a really interesting comment that's just come up on the chat there, saying it feels like cotton wool. Absolutely. So again, another major message that I want to say is that total hearing loss is actually very, very rare. And what a lot of people experience is the loss of clarity, the loss of detail. And that can be very, very tiring, trying to fill in those gaps in terms of trying to decipher speech or enjoy music. So I'll just stop there.
Okay, that's great. So I just ran through that little bit at the bottom of the slide about how people with learning disabilities are not getting picked up for their hearing loss as much as the general population. So we've talked about the prevalence of hearing loss in people with learning disabilities and its impact, and also what audiology can do about it. So now I'm going to talk about what we think the barriers and problems are. And as I was saying, if you do have any ideas of your own, do pop them into chat and we'll see if there's any different ideas at the end of this section. So there's different stages in identifying hearing loss where problems might occur. So recognizing hearing loss in the first place, getting a referral, the hearing assessment itself, and then ongoing hearing management. And there's different people who are involved during these processes. So the autistic person or person with learning disabilities themselves, carers and support, caregivers, carers and support teams, families, GPs and nurses, and audiologists, who are all involved in the process of recognising and managing hearing loss. So we think we know what some of the barriers might be, but the reason for our project is that we want to talk to people with learning disabilities and autistic people to find out what their perspectives are as well. Oops. So the first area is getting a referral to audiology. So this includes recognising the hearing loss in the first place, and then having a doctor refer the person on to audiology. So it may be more difficult for people with learning disabilities and autistic people to recognise and communicate that they have a hearing loss. Carers and caregivers can often overestimate hearing levels in people. So people can quite often be picking up on visual cues and joining in social situations, but could still have a hearing loss. And there's a general lack of awareness of the high levels of hearing loss in people with learning disabilities and autistic people, and a lack of confidence in audiology. So on this slide, I have some quotes from some research by McShay, who was talking to caregivers and carers and GPs to find out their perspectives and to try and improve hearing care. So a quote from a carer was that he won't be able to have a hearing test or tolerate a hearing aid. So there's sort of a general assumption that it's not going to work for that person. And also with GPs, there's a lack of awareness of hearing loss in people with learning disabilities and autistic people. So one doctor said, "I can't recall a person with learning disabilities ever having hearing problems." And apart from recognising the prevalence, it's not always seen as a priority. So there's other things going on, so other things that people are concentrating on. And then there's a misconception that hearing assessments or hearing aids might not be useful for that group. So I think there's a reluctance to refer. One of the questions that would go through my head is, even if this person could hear better, would the sounds they hear have any meaning to them? Is it going to improve their life? So that GP didn't think that managing hearing was going to have any benefit for that person. Another area where there might be barriers is accessibility of the audiology department. So that might be as simple as getting to the department, directions and transport being available for people, physical accessibility once in the audiology department, and then how the department communicates with people with learning disabilities and autistic people. So that could be written or verbal communication, and would be before the appointment and also during the appointment. And then a particular consideration for autistic people is that the sensory environment is very important. So autistic people can experience certain sensory things as being very uncomfortable or even painful. And there's also the unfamiliar context of being in a new environment. So it could be the noise if it's a very busy waiting room, or there could be a lot of clutter, even a lot of information displayed on the walls. Furniture might feel horrible, lighting, sort of those flashing long lights, I can't think what you call them, but those lights, and then smells. So considering that can reduce accessibility for autistic people. And then the hearing assessment itself. So it's an unfamiliar setting with sounds and equipment that the person's unlikely to have experienced before. So that can cause anxiety, especially for an autistic person, where sounds can be unpleasant. If they're worried that they're going to be hearing very loud, unpleasant sounds, that can raise anxiety. Communication and comprehension during the hearing assessment might be an issue. So understanding what the audiologist wants them to do, and the fact that they have to wait and listen for a sound. And there can behavioural assessments, if it's not obvious whether the person's responding, it can lead to the audiologist having to make subjective interpretations, so trying to work out if the person is responding or not to the sound. And then there's behavioural issues, So especially for autistic people, if they get very easily distracted or they have lower sensitivity to sounds, or if their anxiety is causing people to withdraw, these can all affect the accuracy of the hearing assessment. And sensory issues again for autistic people. So hyperacusis is a reduced tolerance to certain sounds. Phonophobia would be a fear of certain sounds, and then hypersensitivity is a lower response to sounds, and also tactile defensiveness. So if people don't like people in their personal space, or they don't like to be touched, because some of the tests will involve putting headphones on and things, so that can be unpleasant. And there's a lack of specialist training for audiologists in working with people with learning disabilities and autistic people. So in university audiology courses, I think there's some training, but it's often quite minimal. So we're looking at training more generally for working with these groups, and then seeing how that will relate, or how that will be useful for specifically for audiology. But audiology has some particular, will have particular specific issues because of the sensory nature of what you're doing. And then ongoing hearing management. So there's need for ongoing support and hearing appointments, and probably also input from other professionals such as speech and language therapy, learning disability nurses, and hearing aids. If the person does need hearing aids, there could be issues around taking ear impressions and tolerating a hearing aid. So again, that's sort of touching and a tactile thing, which might be unpleasant to some people, and some people might require desensitization, so getting used to it over time. So hearing aids probably wouldn't be appropriate for everybody, but because of the benefit that they give, it's probably usually worth having a try. And then there's need for ongoing support and training for caregivers and support staff. So some people might have a lack of confidence in maintaining and using hearing aids, because if people are taking them out all the time, it's sort of takes patience and persistence to sort of keep using them. So there's a lot of issues around confidence and maintenance in hearing aids. And it's important to address these barriers, because if people have very unpleasant experiences when they're in audiology, that may well affect their levels of anxiety and their likelihood of approaching the service in the future. So I don't know, Shanice, if there were any other barriers that people mentioned.
We've had quite a few comments come in about kind of experiences for people themselves, or a loved one or somebody. I don't know if you want me to run through those now, Marianne.
Maybe if there were a couple of examples, possibly,
yeah,
that would be good.
So one of them was there being difficulties to get access to testing for people with severe or profound and multiple learning disabilities. So that's clearly a very specific group, and those needs will need to be considered in the context of audiology. And Siobhan, I imagine you'll have more kind of more to say about that. What else have we got here? Yeah, just kind of somebody has made the link between wearing face masks as a result of the pandemic, and now getting increased reports of kind of people recognizing a hearing impairment, and how that's kind of changing at the moment. So yeah,
that's great. It'll be really interesting to have a look through the chat later and see what people have put, and if in the groups at the end we could maybe have a chat about some of those things.
Yeah, definitely.
Yeah, so we've looked at some of the barriers around accessing hearing services. So the next section is looking at what we could do to improve hearing services for people with learning disabilities and autistic people. So the main areas would be improving awareness of hearing loss in people with learning disabilities and autistic people, looking at the referral process, accessibility, adjustments that we can make to the hearing assessment, and the importance of ongoing management. So in terms of raising awareness and training, increasing awareness of the prevalence of hearing loss and its impacts is important for a lot of groups who are working with these, with people with autistic people and people with learning disabilities. So that could be caregivers, support organisations and primary care providers as well. And also to increase awareness of the impact of audiology services and the fact that audiology can make adjustments to how it works to cater for different needs. There's also need for support and training in the use and maintenance of hearing aids, and also improving effective hearing assessments. So at the moment there's yearly health checks for people with learning disabilities, but these rely quite a lot on subjective assessments. So there's a need for it to be more objective because it's not picking up on hearing loss. And there's also a pilot of a health check for autistic adults, which is starting, so that would be relevant for that too. There's a need for specialist training for audiologists in how to communicate and work with people with learning disabilities and autistic people. So at the moment, there's the Oliver McGowan mandatory training in learning disability and autism, which is being trialled and is based on the core capabilities framework. So what skills, knowledge and behaviours people who are working with those groups need to be able to provide effective care. So that's something we would be looking at, how it applies to audiology. And then research into the best means of delivering hearing services. So whether it's better to be in a specialist service or whether it can be provided in mainstream services. And also one of the things we'll look at is the role of high street providers, so hearing tests in Specsavers and places like that. So making reasonable adjustments. This comes from the Equality Act 2010, which says that disabled people should have equal access to good quality healthcare. So to do that, you have to look at the adjustments that can be made to remove barriers for disabled people. So that could be general things, which could be done across a department, so looking at accessibility, or it could be case-by-case adjustments. So if one person has a specific communication need, then you would make adjustments for that specific person. And then identifying and flagging needs. So in the person's health records, they should have their needs identified and flagged so that anybody working with them in the future can see what they need to be able to have equal access to healthcare. And by 2023 or 24, there's digital flags should be used to support healthcare staff to make these reasonable adjustments. So that would then be in their health records and would simplify the process. So you don't have to keep asking people over and over again what they need to access healthcare. So one example of a sort of general adjustment is becoming an autism-friendly environment. So there's checklists from NICE and the National Autistic Society, which look at your lighting, your furniture, the noise in your department, smell and visual information, which can be useful for considering how you can make your department more comfortable for people who are autistic. So referral and accessibility. Pathways could be provided for self-referral, so you don't always have to go through a GP. I think there's some specialist departments that do allow self-referral. Making sure that there's adequate staffing in audiology departments so that there's to ensure that the waiting times aren't too long. So that would mean having enough specialist staff as well who could work specifically with people with learning disabilities and autistic people. Making sure your physical access is adequate and providing clear directions to the hospital or audiology department. So that would include having signage in the hospital that makes it easy to find where you're going. and providing quiet waiting areas and or appointments at quieter times. So this is particularly for people who struggle with being in a very noisy environment. And then flexibility around appointments, so including provision outside the hospital. Some people, it might be better to have appointments in familiar environments like their home or day services, and flexibility of appointments, so offering appointments at different times of the day. And then, so the Accessible Information Standard is a law which aims to make sure people with a disability or sensory loss are given information they can understand and the communication support they need. So this is a law that says that any information that you share with people with learning disabilities and autistic people needs to be in a format that they can understand. So that could be, you might use easy read, or you might have a specific font size, or using video or sign supported. And it applies to any information shared, so appointment letters, results, information sheets, directions to the hospital. And it also applies to how you communicate during appointments. So if somebody signs, then you need to have a translator, or if somebody uses Makaton, symbols, picture support, or specific communication tools that they use to communicate, then you need to be aware of that and make allowances for it in appointments. And again, flagging and sharing those communication and information needs. So preparing for the hearing assessment, it's really important to prepare beforehand so that you can put in place the adjustments that people need. So in terms of the information that you provide of what's going to happen before the assessment in accessible formats. And then you could possibly introduce the staff beforehand, or allow the person to visit before they come to the hospital, allow people to ask questions in case they have any anxieties. So there's some really nice videos and resources that I've seen on the internet for departments that have sort of specialist provision, but they're quite weighted to using videos of children and things. So I think one of the things we might look at is whether we could have videos on our study website, which would be accessible and would explain to people what was going to happen in appointments in a more appropriate way. So as I said, you need to have an assessment of what people's communication, sensory and behavioural needs are before the appointment, so you can make adjustments. And also, if somebody is non-verbal, discussing how they express distress so that you can respond to that if it does occur during the appointment. And adjustments that can be made to the hearing assessment, so giving longer time for appointments, including breaks or splitting into multiple sessions, and also the option to leave if necessary. So it's important for some people that they know they can get out if they're getting anxious. People could explore the equipment or hearing aids before using them, so have a little feel of the equipment or a look, and sort of become familiar with it before going straight to do things. And possibly allowing people to sit where they're more comfortable. So if somebody's more comfortable on the floor than sitting in a chair, then making adjustments to be able to do that. There's modifications that you can use to the actual tests themselves. So you can look at how people observe how people respond to sound, and use pictures and sort of play things, like putting things in things rather than just pressing a button. You can incorporate familiar items and special interests to measure responses to sound. So particularly for autistic people, they quite often have something that they really love, and it's a special interest, and that could be incorporated into the hearing assessment, along with using interesting or familiar sounds. Giving people longer to respond to the sound, and maybe not doing quite as many tests as you would normally do. And also, if people really can't tolerate headphones, you could possibly use speakers rather than the headphones. And then in terms of ongoing management, you'd be looking at ongoing support for assessments and management, follow-up clinics, support for hearing aid fitting and maintenance, and then providing follow-up information in accessible formats, and involving multidisciplinary teams is important for going forward. So as I said, speech and language therapy, maybe occupational therapy, and learning disability nurses. So, okay, there was a lot of information there, but that's what we sort of think are the barriers and some of the ways that we could improve services for people with learning disabilities. So Shanice is just going to talk a little bit about our actual project, and then there'll be a chance for people to answer some questions. Okay.
Yep, thank you for that, Marianne. So this picture at the top of this slide here, this is from our website, and there's a link to our website just there on the second bullet point. So we're going to update that soon, so you can have a look at that. But really, so our project, the Audiology Learning Disability and Autism Project, our aim really is to identify how hearing services can be improved for people with learning disabilities and autistic people. And we also want to find out what challenges audiologists face and staff who work with audiology, who also support people with learning disabilities and autistic people. And so to kind of find out more about this, we're going to be running some focus groups and interviews with people with learning disabilities and autistic people. So really, we want to speak to people to find out their perspective on how services can be improved, and to help inform those recommendations that come out of our project. So we'll be running separate focus groups for autistic people and people with learning disabilities. And also we'll be doing our groups separately for adults and for children and families. And we also want to speak to audiology professionals in interviews, which I think Siobhan is already underway with that. So yeah, if I could have the next slide, please, Marianne. So yeah, if I talk a little bit more about what the focus groups and interviews will involve, we really want to find out kind of what it is like to use hearing services, and what's good and what could maybe be better. And we want to know kind of from the perspective of people who've used the services or have wanted to use the services, what it is like and whether they've come across any barriers. And during our focus groups and interviews, we want to show some resources that hearing services use to communicate with autistic people and people with learning disabilities. So that might be kind of leaflets or online videos, or what kind of the things that are currently being used. And what we want to know really is kind of, what do people think of them, whether they're good, whether they could be any better, and if so, how. So I'll pop to the next slide, please. So for our project, kind of just on this slide here, we've written a bit about the importance of including people with learning disabilities and autistic people in research. So really kind of the idea of nothing about us without us is kind of the key message, that autistic people and people with learning disabilities should be involved throughout the research process. And that means being consulted during the planning and the running of the study, as well as speaking to people about their views on hearing services. So we will be speaking to experts by experience to understand really the lived experience of accessing hearing services. And really we want to take an inclusive approach. So we've put we've mentioned Autism at Manchester here because they've developed some guidelines for conducting research with the autistic community, which kind of really sets out some useful guidance on what a participatory approach to research might look like. So how to go about kind of developing a project where experts by experience and researchers are on an equal footing in the research process. So we're very kind of interested in incorporating elements from that. And really inclusive research is about valuing the contributions of people with learning disabilities and autistic people. So as I said, it's really important that the perspectives of people with lived experience are considered and inform the guidelines and the recommendations for audiology services that we develop in this project. So in terms of how we've kind of been including people with learning disabilities and autistic people in our research, we have an ongoing collaboration with a number of advocacy groups. So we've been working with Sheffield Voices, which is a self-advocacy group for people with learning disabilities. And we've been working with Autism at Manchester with their advisory group, which includes autistic people. And they've kind of been giving us ongoing feedback about the information that we're using in our project and how we might go about running our focus groups and making them as inclusive as possible. So one of the things, for example, is about accessible information during our project. So we've developed a number of easy read versions of our study information and posters, and these have been looked at by Sheffield Voices and the Involvement Matters team of the East Sussex Learning Disability Partnership Board. And it's really important to have that feedback to make sure that we are, engaging as kind of widely across the community as possible. And kind of really important aspect of our project is making adjustments to our focus groups and our interviews. So we will be holding online focus groups for autistic people, but we're also going to have the choice of kind of interviews if that's more appropriate for someone, or if somebody would prefer to speak in a one-to-one setting than a group setting, and that would be absolutely fine. We're also going to kind of have other ways of providing feedback depending on what each individual would like. And yeah, really it's about making adjustments for communication and behavioural sensory needs before the group. So we will speak to each individual. If you are interested in taking part, we'll speak to you about any kind of adjustments we can make to make it kind of the focus group or interview or whatever setting as comfortable as possible. And yes, we've been reaching out to local groups in Kent, Surrey and Sussex to just build that network and help us really to deliver our project. And ultimately, it's really important that we are open and honest about what the research entails. I've seen a lot of research coming out, informing us that autistic people, for example, can find it quite challenging to take part in research if something happens that they feel like they weren't told about in the beginning. And that can lead to a lot of uncertainty and anxiety. And we want to kind of make sure that in no case that situation will happen as far as possible. So we're really willing to answer any questions we can about the project and be clear on what we will be asking, what we won't be. And then, so here I'll just talk about our next steps. So we are now recruiting participants for our project. So we're looking for people with learning disabilities and autistic people who might be interested in taking part in a focus group or an interview. So if you are someone who has had a hearing assessment or tried to get a hearing assessment, and if you live in Kent, Surrey or Sussex, and would be interested in talking about your experiences in a focus group or an interview, then we'd really love to hear from you. We're also looking to collaborate with any local support organisations who might be here today. Just looking to kind of with some help to disseminate information to groups and members and just get the word out about the project. And if you could help, for example, facilitate our face-to-face focus groups, because we particularly want to make sure we're holding our groups in an environment that's comfortable for our participants. So if it's a known environment, that would be really, really great. And yeah, we're also looking to speak to audiology professionals within our interviews to find out about what provision is currently available for people with learning disabilities and autistic people. So here are our contact details next to our lovely faces. And I think that's everything. And our website is also at the bottom of this page as well. So if you're interested in looking at that. Thank you.
Great, so that's the end of our talk.
Yeah.
Excellent. Marianne, Shanice, Siobhan, thank you ever so much for that. Now, I know that there's a lot of questions and comments in the chat box. I wonder whether we might want to go through some of these and just to acknowledge the contributions that people have made and see whether whether these are questions that you're able to respond to directly, or whether they're things that need to be, taken away and thought about a little bit more. Let me see. We went back as far as there was some conversation about tinnitus and about so Sarah said tinnitus is any sound. I think this was responding to somebody else's comment about somebody experiencing tinnitus and defining what tinnitus is. So thanks for that, Sarah. Kirsty says, is there a place for people with learning disabilities accessing local hearing test providers, e.g. Boots, or should they always be referred to NHS audiology? Have you got any thoughts around that?
Do you have an answer for that, Siobhan?
Yeah, that's a really, really interesting question. This was something actually that Sheffield Voices brought up with us, is the fact that accessing a hospital and accessing the high street is a very, very different experience. Because in terms of training and working with individuals with learning disabilities and autistic people is very variable, and within the NHS and within the private sector, the training routes and the training available are likely to be different. And this is actually one of the areas that we felt it was actually quite important to engage with the private sector. Being NHS based, what we want to sort of make sure is the fact that we also have those voices from the private sector in terms of what is available for individuals. So for instance, that electrophysiology tests that I was talking about, we have found in Sheffield, for instance, that is a very, very useful test for about a quarter of individuals with learning disabilities, because behavioural assessment may not be as accurate as we need it to be. So we would move to electrophysiology. The accessibility of electrophysiology in the private sector may not be as widespread as it is in the NHS. And so there are factors like that which may be different. So I hesitate to speak for, I really am trying to be very careful not to speak for the private sector because I'm NHS based. That being said, I think that what is available in the two different, the sectors may be different. And while somebody, for instance, may approach either the NHS or the private sector, they may want to then consider the other sector depending on what's available to them. And it's worth finding out what is available right from the start.
Thanks for that, Siobhan, and thanks for that question, Kirsty. There's some conversation about annual health checks, and I know that that within your presentation you referred to annual health checks and how hearing is part of that. Now, I think one of the comments that's made here about annual health checks is that there's purely a binary kind of yes or no answer as to whether somebody's had a hearing check or not. Are you aware of there being anything else that associated with health checks around hearing?
Yeah, I worry a lot about annual health checks whenever it comes to hearing, actually, I have to say, and I don't hesitate to say that. I think that the annual health check around hearing, for instance, will involve saying, do you have any concerns? And we know that sometimes a hearing loss can be missed simply by asking the question, do you have any concerns? Because as Marianne was pointing out, there can be a lot of attribution of difficulties that somebody may be having to hearing being attributed to other factors. And so hearing loss being missed in that way. So certainly the annual health check, we have received lots of referrals through the annual health check, but to be honest, I think that there is a lot of scope for the annual health check hearing aspect to be developed and improved, and for if there are any concerns, for somebody not to wait for their annual health check and just request a referral straight away.
Good.